Compliant Coding Systems Coding Academy is pleased to present a brief presentation to you on why learn risk adjustment or HCC coding. The answer is quite simple. You will need to. Risk adjustment or HCC coding applies to all major payer categories: Medicare, Medicaid, and commercial health insurance. Ask you, as a medical coder, how do you perceive your role? Do you work in a facility or doctor's office, submit claims on UBs or 1500 forms? Is your focus procedures, whether it be visits, office visits, surgeries, testing, other studies, whatever environment you code for, your focus is primarily procedures, correct? We want to talk about ICD-10. The use of ICD-10 is required by law. It has been since the Medicare Catastrophic Act of 1988, updated by the Health Insurance Portability and Accountability Act, HIPAA, and it is required by law, and this includes official guidelines for coding and reporting, all tabular instructions, and AHA coding clinic. Folks, when it's required by law, that doesn't mean adequately or partially, it means fully. Why no risk adjustment in HCC coding? I'm going to give you a statement, and then I'm going to give you some examples throughout the presentation. Provider encounter data will be received unedited by CMS, as I'll demonstrate. Providers will be accountable for accurate coding. And when we talk about accurate coding, that's all coding, diagnosis, and procedures. Risk adjustment knowledge will be applicable to all providers, as we'll demonstrate. A excerpt from a CMS communication using diagnoses from encounter data. Okay, and I'm going to show you a bit more on this. CMS's goal is to transition entirely from using diagnoses submitted to RAPs to using diagnoses from encounter data. And I'll explain a little bit more about this in a moment. An important Q&A. Currently, a plan may scrub certain diagnoses prior to sending the RAPS file. For example, if a member has a history of breast cancer, but the provider submits a diagnosis of breast cancer, should plans continue to scrub diagnoses for the encounter data system? And the response from CMS is that MAOs, or Medicare Advantage organizations, should submit encounters as they are received and should not conduct any additional filtering or scrubbing processes. Folks, that means a provider's data that they submit to a plan will be forwarded to CMS. If it is error-ridden, it will be received by CMS as error-ridden, okay? And this is key to risk adjustment and key to compliance. Another reason to know this is it's in the contract, and I'm going to demonstrate this here, okay? Give me a moment to pull this up. And folks, these are actual provider manuals. And you will see risk adjustment, data validation, risk adjustment, okay? You will see in these SNP, special needs plan, which is a component of risk adjustment. You're gonna see here, you're gonna see HEDIS and risk adjustment data validation, okay, CMS. You are going to see risk adjustment validation audits. You're going to see encounter data for risk adjustment purposes. You are going to see CMS risk adjustment data validation, CMS risk adjustment, folks. This is all in provider manuals, and you can visit any provider manual, especially if you have it in PDF. You can search, can hit Control F and just search the term risk and see what your provider manuals say your obligations are as a provider under risk adjustment, folks. Another component to this is risk sharing. What is risk sharing arrangements? Providers have set metrics to achieve, and if they do so, they get a financial reward. Commonly, a financial target is set as a percentage of the health plan revenue. The performance year's total actual cost for the population compared to the target to determine the aggregate savings or losses. The savings, the difference between the target and actual costs accrued to the health plan is shared with providers. And also in these shared risk arrangements are often language that if there is a deficit or a loss, that is spread amongst providers as well. So folks, there is financial incentive and financial stakes for providers. Okay, and the providers are taking note. This is an email, one of many communications we receive from medical practices. This is an actual email, growing practice of 4 providers serving Medicare Advantage patients interested in learning more about risk adjustment services, folks. Providers are understanding through shared risk agreements, through audits, they are being held accountable. I said I was going to explain a little bit about that language, the RAPS to EDS. Historically, in risk adjustment, insurance carriers requested records from providers. They had their coders go through them and refine the coding, and that information was sent to CMS versus RAPS via RAPS. That has changed, folks. It is now through the EDS system, and that means that the claims data that providers submit to the insurance carriers is then forwarded to CMS. CMS is getting your dirty claims as well as your clean claims. And when we talk about claims, we're talking about not only procedures, but diagnosis coding. And folks, statistics show that diagnosis coding accuracy is as low as 35%. Okay. I had a conversation via text with a AAPC chapter officer who was inviting me to come speak at their chapter. You'll see where the arrow is. When I approached this to our chapter members, over half had no idea what I was talking about. That's not uncommon, folks, but the day is coming where just about every coder is going to need to know about this, okay? And you can see here the opportunities: 100, 20, 100, 60, 300, okay? Folks, this is not made up. These are all actual opportunity posts. This one, as I did the presentation today, this is, you see, it was just 4 hours. Of course, it was longer than it was today that this was posted. You look at the dates, September 12th, okay? People, providers, and organizations are looking for risk adjustment coders, and the day is coming where it won't be enough to be a professional coder. You'll need to have the knowledge, if not the certification, of risk adjustment, okay? You will need to know this, folks, and whether you get the certification or not, okay? But the opportunity is unprecedented, okay? You know, it's really a matter of learn it now or learn it later. A hiring decision maker at a medical provider's office has 2 resumes, equal experience. Those resumes might as well be identical. And I'm a coder CPC and super coder CPC CRC are both in contention for the position. Under the risk adjustment requirements, which do you think will be more marketable for that position? Where do medical providers receive their operating revenue, folks? From insurance carriers primarily, right? So if your organization see payers as their money tree, you may want to fertilize that tree. So are you waiting for opportunity, or are you going to create it? Now, there's some testimonials here, and if you want to pause, you can read them, or you can come back to it. It's a video, so you can certainly pause it and come back. There is a certification in risk adjustment, and again, whether you seek the certification or not, this knowledge is essential knowledge. Quick facts about Compliant Coding Systems Coding Academy. We've trained over 6,000 professionals for success. We offer more than any other program. We work in risk adjustment every day with contracts with prestigious clients. We work in risk adjustment every single day. We offer more complete support than any other organization. We have an outstanding reputation in the industry, which I'm going to share with you in a moment. And we have been providing risk adjustment training long before a certification existed. We also hold 2 live webinars each week for our registrants. Our program is AAPC approved, and we are an AAPC licensed education provider. You'll see this testimonial and basically where the arrow is, I'm willing to hire without the experience if they've completed your course. This is the type of reputation we have in the industry, folks. Another manager with a Medicare Advantage plan. And again, I encourage you to pause and read, or come back to it if you'd like to read these testimonials. And if you'd like to reach us, you can reach us on the web at compliantcodingacademy.com. You can email us at info@compliantcodingsystems.com, or you can call us at 866-303-4650. We hope this information is helpful, and we hope that you enjoy a long and thriving career.